Thank you for coming to this. I'm very pleased to see the press engaged on this issue. My name is Ms. Ikponwosa Ero, but if you want my full contacts, I have the cards up here, including my social media if you want to link your stories online. So my mandate, which is the independent expert on the enjoyment of human rights by people with albinism, was created at the United Nations Human Rights Council in Geneva in 2015. One of the main reasons why it was created was in response to some very extreme violations against people with albinism in 28 countries, where they are being attacked physically. They are hunted down and attacked with machetes and knives, and their body parts are cut off and sold on a black market for thousands of dollars. And this is due to witchcraft-related beliefs that these body parts can bring wealth and good luck when used in potions. So these are very extreme violations. When the mandate was created with this in mind, there was also the idea that it will be an opportunity to collect data from other countries as to what's happening, good or bad, because it's good not only to broadcast what's bad, but to learn from what's good. So while I was working, especially with countries that have these problems of attacks, which unfortunately are still going on, I saw that there was some action in Fiji on awareness on albinism, and some data had come out that piqued my interest, saying that there was about 1 in 700 people with albinism in the Pacific as a whole. This is quite high. Normally, the condition is relatively rare, even though everyone seems to know about it because it stands out quite a bit. I am a person with albinism myself from Nigeria, and I know what it's like to have this condition where you stand out. Most countries have a prevalence rate a little bit lower than Fiji. So, for example, in North America and in Europe, it's 1 in 17,000 that have albinism. In sub-Saharan Africa, it's a bit higher, with 1 in 5,000 to 1 in 15,000, with many communities that are specific having 1 in 1,000. So it varies generally. There are also some Aboriginal groups in North America and South America that have 1 in 125, and in some cases 1 in 70. So there's a variance depending on genetics. For example, I learned from a researcher that she was proposing that in Fiji, most people with albinism are from the Itoke community, likely because of the genetic predisposition they brought with them from where they came from, whereas, and they have a smaller gene pool, whereas the Indo-Fijian community came from different parts of of India, and so have a wider range of genetic pool. So you find less people who are Indo-Fijian with albinism. So it's all very interesting, but nonetheless, when I heard about this estimation, I was interested, and I spoke with the government, and the government was very open to the idea of my coming to Fiji, and eventually they sent an invitation, and I'm very pleased with this level of openness. And I have been discussing with them, and they've been really engaged on the issue. One of the implications of having albinism, aside from the physical appearance, which is quite striking and can be a source of stigma and discrimination, and the coloring can be a source of these problems, there are also vision impairments, which varies from person to person, depending on what type of albinism you have, if you got early intervention to care for your vision. So that's one. The second implication is a health implication, where there is a high vulnerability to skin cancer. This is it's a real problem in countries with data. I've learned in some countries that only 2% of people with albinism live beyond the age of 40. Most die before age 40 to this preventable condition, which is caused by frequent exposure to sunlight without protection, such as sunscreen, education about skincare, very basic information. I don't have information on this in Fiji. Nobody has been monitoring. Nobody really knows who has had skin cancer or who has died from it, except for 1 or 2 anecdotal cases. I don't have strong information. What I do know is this issue has been invisible in Fiji for many years, and thanks to recent activity in the last 2 years by an organization called Fiji Albinism Project, which is run by foreigners, mostly from Australia, functioning on private donations, this issue has come to the fore. In 2014, they had a workshop at the School for the Blind, which raised a lot of interest and led to a big symposium in 2015 at the Holiday Inn, which really was a turning point on this issue in Fiji. It is true that the numbers are low compared to a lot of issues, but it's also true that because there are low numbers, the issue will forever be neglected if there is no specific intervention or specific attention brought into light. So officially, on record, I would like to thank the Attorney General for making this visit quite fruitful, and all the ministries. I would like to thank the United Nations, especially the Office of the High Commissioner for Human Rights. I would also like to thank you for participating. Before I go into my observations, I would like to say that this is a great opportunity for Fiji to pay attention to its people with albinism for three reasons. First, Fiji just ratified the Convention on the Rights of People with Disabilities in June this year. Fiji is also adopting a national law on disabilities, which is before Parliament. It will be adopted early next year. And Fiji is part of the Sustainable Development Goals of the UN, which is guiding the development agenda of the UN until 2030. And those goals have many components that are applicable to this issue, including in health, in education. But it also has 7 times repeated the principle of leaving nobody behind. A society is judged not by what it does for the many, but what it does by those on the margins. So I think it's very important that we understand the value of bringing in people who have been left out for centuries. While I was here, I was able to meet the executive, the legislature, and the judiciary. I met with the National Human Rights Commission, and I also met international organizations, international cooperation organizations such as embassies, civil society groups, including religious leaders and traditional leaders. I also met with close to 30 people with albinism who are Fijians. Some of my findings are as follows. These are preliminary findings alone. There will be a full report produced and submitted to the UN Human Rights Council, unfortunately in 2019. However, we have statements here already capturing all the the essentials of my findings. So if you read our statements, you will have all you need. First finding, data. There is no data on this issue generally. I find that the government was very honest about this issue. They are very aware that it's a problem. Data is missing. I don't have anything. I cannot tell you how many people with albinism are in Fiji. I only have the prevalence rates. The census missed the opportunity to count people with albinism. The census had a section on disability, which is based on international guidelines. But there was no indicator there on albinism. So nobody with albinism ticked anything, because do you have a hearing impairment? Do you have a vision impairment? They didn't tick anything because it doesn't capture their condition. It's important to have an indicator that says albinism, so you can address not only the vision impairment, but also the skin issues. So this is a problem. There have also been surveys that have been carried out by the government that also missed this indicator. So as a result, I'm recommending supplementary data gathering through surveys, through the Ministry of Education, through the use of community rehabilitation assistants that report to the Minister of Health, and also through what they call the HIE surveys. It's HIE. HIE surveys are household information and economic surveys. I believe that's what it stands for. Recommending that in the meantime, before the next census, we take advantage of these structures to gather information on the data concerning people with albinism. The second finding is discrimination and stigma. A lot of people I spoke to without albinism said, these people, they're working amongst us, they're okay, which was interesting. When I met people with albinism, I did not get the same feeling when I asked them more directly, and I guess most of them were open because I'm a person with albinism, I understand what they're going through, and there was, in most cases, an emotional breakdown concerning what they've been going through. You get a sense that the suffering has been at the private level. I got comments such as, I cannot believe I have this opportunity. I've been waiting my whole life to share this opportunity. Finally, somebody's listening. And some of them just, Yeah, they've gone through a lot, including the families and the mothers. There's been child abandonment, parents who have abandoned their children. Some of them don't go out because they're walking on the streets and you're just taunted from the moment you come out of the house to your destination. So there are issues there. There were exceptions, of course. Some people, due to their socioeconomic situation, have managed to avoid many difficulties. But nonetheless, the majority, the overwhelming majority, had issues in this area of discrimination and stigma. So that's attitudinal problems on the one hand. Recommendations on attitudinal discrimination, of course, is obvious, is awareness raising. Awareness raising not only to the public at large through things like documentaries. There was a documentary called Coming Out of the Shadows on albinism in Fiji. It's actually showing tonight in a film festival for some of you who are interested. There's also training needs to be done on what disability is. There's a question of, are these people disabled? Are they not disabled? Even people with disabilities don't know the new understanding of disability. Okay, so we need a lot of training and awareness raising. Even you in the media, I think, could benefit from this training. Just to clarify, since we have the opportunity, that in the past, disability was very traditional. Are you blind? Are you deaf? Are you using a wheelchair? Now disability has shifted to be more flexible and all-encompassing, such that all that you need to find a disability now is an impairment. And once you have that impairment and it's permanent or long-lasting, and you have a barrier in society, then you have a disability. That's the equation. Impairment plus barrier equals disability. If you take away the barrier, the disability goes away. So people with albinism generally have disabilities because there's a vision impairment or a skin impairment. They have barriers, the result is a disability. The other segment of discrimination is coming from structures. So we've talked about the attitudes. The structures are twofold. You can generally separate them into health and education. In the health sector, the problem is largely there is no specialized care for people with albinism to prevent skin cancer. Like I said, this is a fatality. People with albinism have vulnerabilities to dying from skin cancer without care. I met somebody who likely has skin cancer that was discovered during my interview. So this is concerning. For now, all there is concerning skin screening is all done by foreigners, and there is very little government support. So I have recommended to the government to take charge of this Fiji Albinism project, which caters to the skin problems of people with albinism. We need to train more dermatologists. There's only one dermatologist in all of Fiji. So this is a problem. The government is aware of this, and I hear that there are going to be trained dermatologists next year in collaboration with the Fiji Albinism Project. There also needs to be a type of mobility of this clinic so that it's not only in Suva. Right now, this clinic by the Albinism Project is only in Suva, and people out there say they don't have money to come to Suva to check their skin. And that's why you can see with people with albinism have all the spots. They don't have to have that. I don't have it because of care and protection, and I hopefully don't have skin cancer as well. So basic interventions such as this clinics going out into the community can save lives. There are already clinics doing this. It's just a matter of incorporation. So we've recommended incorporation into existing clinics. We've recommended that sunscreen, which protects the skin from skin cancer, not only be for tourists, but also be an essential medicine. HIV/AIDS has essential medicines such as the antiretroviral medicines, which come through an essential medicine list that the government facilitates. So we've requested to the Ministry of Health to put sunscreen on that list because it's essential for people with albinism. They are in agreement. So I'm looking forward to this coming in. Looking forward to them removing taxes and duties on these imports. Also looking forward to them eventually developing sunscreen in Fiji. We have countries that have done this. It's not expensive. It sounds expensive, but it's not. The Attorney General is very open to this, so I hope next time I come to Fiji, we'll be producing sunscreen here in Fiji and supplying the region, and maybe tourists as well. This could be a lucrative source of income, not only for Fiji, but for Fijians with albinism. The second and final part of discrimination is in the education sector. A lot of people with albinism are sent to the school for the blind, and while they're there, they're taught Braille. You don't need to teach them Braille. They just need special gadgets to see distances, and most of those gadgets are not here in Fiji. So these students are learning Braille when they don't need to. Many countries have phased out the Braille approach for people with albinism, but it's still happening here. And we need to get in those gadgets that are needed for the students to be able to go to school. A good number of the people I met dropped out of school because of lack of support, so this can be rectified. Overall, I think we have a lot of opportunities to fix these issues. Okay, there are many frameworks existing in Fiji. I don't think it's that difficult. I think the government is welcoming and is ready to engage. So I have a lot of optimism that things are going to improve very quickly in Fiji with focused and strategic interventions, with my support, the support of the UN country team. With a law being passed in February, I hope that law leads to a national action plan that has various forms of disabilities detailed and interventions detailed. So it's not only about let's help people with disabilities, it's also about we know what to do concerning people with disabilities. I also look forward to operationalizing some of the recommendations that I have made concerning issues in health and also issues in public awareness and awareness raising, and to shift people with albinism out of the shadows of obscurity and private suffering into the enjoyment of their human rights. I thank you very much, and if you have any questions.